Okay, so we're going to dissect a chicken wing today. You might need a few tools. You'll need some little scissors. You can use cuticle scissors. You can get these for maybe $5 at Walmart, or maybe you already have a pair. These are a pair of dissecting scissors, but cuticle scissors can work just fine. They have a curved end to them, but that'll work just fine. Maybe some tweezers and some kind of sharp scalpel or an X-Acto blade. Some kind of sharp knife is what you'll need. So just looking at the chicken wing, we have it laying on its ventral side up. So this would be the side you would see on the outside of the chicken with the feathers. Right wing? So this would be the right wing. Okay. And so this would be the ventral side. This is like this side of your arm. And this side is like this back side or this dorsal side of your arm. So we're going to want to start with the ventral side up like that. And you can see the skin is really thin here, and you can see all these blood vessels underneath the skin. The skin is very, very thin. So the outermost layer that you're looking at is that epidermis made of epithelial tissue. And then, so if you were to look at a cross section of it, on the outside here you'd have all those squamous cells filled with keratin. If you could take a cross section, that would be on the top, and then as you go down through, the bottom side here would be the dermis. It's very thin, it's microscopic, so you can't really see it. You can imagine in your drawing what that would look like.
Cross section.
Yeah, so do like a cross section there. So then you're going to want to start separating the skin from the underlying tissues, and you can see that it's connected with a lot of connective tissue. You can see these pieces of connective tissue right here and here. And so you're going to have to separate those a little bit. And you can stick your finger in there and just pull up on it. The skin is very tough. You're going to really appreciate how tough connective tissue is by the end of this dissection. So the skin isn't just laying on there like that. It's connected to the tissue underneath it. See, now we have it laying on there, but it's actually connected. All these strings, you can see that, all this connective tissue. Okay, so to start separating it, we're going to lift up a bit, and this is where you're going to use your scissors, and you want to just cut, lift and cut, as if you're cutting wrapping paper, maybe, imagining that you're cutting wrapping paper. So we're going to cut down this bone, and along here, and down there. And we're going to just lift and cut. You can use your tweezers if you want, or you can just use your fingers too. So we don't want to cut down too far. We just want to cut the surface here if we can. So we cut through the skin here. And you can use your hands to start peeling this back. Oops, we cut down a little too far on there. And you peel back, see all this connective tissue there? To peel that away from the muscle. See if we can try to down under here now. So peeling the skin back. You can see all that connective tissue there. You can even use your finger to kind of peel that away. Peel the tissue down here. Peel the tissue away from this joint, and the skin away from the joint there. Okay, so we've peeled the skin back here, and you've probably noticed already this big shiny structure right here, and that is a muscle, but it's covered with a lot of connective tissue. So the muscles are in their own connective tissue bags, like this muscle up here. You can see this is really shiny.
This is the texture of the bag.
Yeah,
too.
you can see it's very, very shiny in comparison to this is muscle tissue that I cut out of the bag, and it's a lot more fibrous and a little more fragile, and you can see how it tears apart. When we get to draw some muscle, you'll see all those muscle fibers there. And so this muscle is still in this connective tissue bag, and so this outer covering is part of that bag that's covering the muscle underneath it. We'll cut it open in a minute, but there's also a tendon running along here at the ends of the muscle, so that shininess is all connective tissue, that big shiny structure you're seeing there. So we can see some blood vessels. There's a little blood vessel there running all the way along here. There's some blood vessels up here. So see if you can find some blood vessels. Alright.
There's a tendon peeking through.
Yep. Yep, so here's a tendon underneath there. So the tendons are going to be really white and shiny and really, really tough. Okay, so let's compare our wing to this bone diagram here.
Okay, I can see that.
So we've got a humerus is the bone that's coming down here, and this is kind of the equivalent of your elbow joint. And then you have the radius and the ulna, two bones that are the same in your hand. So these are them right here.
Okay.
So we're going to find two bones in there, and then you kind of have this wrist joint, and then there's this little winglet, the allula is what it's called. So it's kind of the equivalent of a thumb. So it's a little finger-like projection that comes off of the wrist. And then there's the carpals that are right here, and then the phalanges are at the very end here, the little fingers equivalent. So all these muscles are connected to the joints and to the bones by tendons, and you can even move them around a little bit if you. So this is the bicep muscle here and the tricep. If you kind of grab that muscle and you can pull on it. Let's go try the tricep here. You can see that
there
extends.
It goes out.
If you pull on this, it's extending the wing. Let's see if I can do it like this instead. So you can kind of extend the wing. You could pull on this muscle group, and this will make it come back in like that. So I wanted to take a look at that before we cut these tendons. So there has to be a muscle that both, pulls the wing this way and then opens the wing again. So these two muscles work kind of an opposite effect. As this one shortens, it pulls the wing this direction, and then when this one shortens, it pulls the wing open like that. Okay. So let's take a look at these muscles again in greater detail here. You can see that they're in these bags, and this connective tissue that's acting as a bag for each of these muscles is usually called fascia, and it can mean some other tissues in the body, but we're going to use it here to name these coverings for each muscle. And you can see that there's actually two muscles right here, and they're even separated by, there's a little white line here. So there's a separate bag for this muscle and a separate bag for this muscle, so there's two there. And then there's another bag for the muscle that's down here. And we should be able to actually take those coverings off and see that each muscle's wrapped individually in its own fascia. So you can take your scissors, just gently cut, again, kind of just like you're cutting wrapping paper, just very gently. Okay, so there we've cut open this first bag, and maybe I'll use my tweezers. There's the fascia, and underneath is the muscle tissue, right there. There's the bag. You can see it's separated. See how here's a muscle. Here's the muscle right here. And there's a muscle that's still in this bag. So we were cutting along and we cut open this fascia here, but there's another muscle that's right here. See, its bag is still intact. So they're all bagged separately, and then they're kind of sometimes they're grouped together, and then they're in a kind of an even bigger fascia. Okay, so the next thing we're going to look at is this tendon here. We want to try to dissect out one of these tendons. So we'll have to cut through some of this connective tissue to get down to it. And I'm going to kind of lift this fascia over here and cut through it. So this now we've cut through this fascia. There's the muscle down underneath there. It's the muscle tissue. You can see it's just laying in this little bag there. Okay, so let's look at this tendon. So the bag kind of becomes part of the tendon at the end here. As we cut down here, this whole fascia kind of becomes part of the tendon as it approaches the joint. And it's going to anchor onto the bone here. And this is the tendon that we were interested in. So if you can get underneath there, like that. You can appreciate how strong that is. Put your hand down there and try to pull that a little bit. It's extremely strong, especially in this direction. It's an extreme amount of strength. You can see it's very flat, shiny, white, and very tough. So we're going to follow this tendon down to the joint. We'd like to start opening up this joint and taking a look at the bones down here. I'm going to just cut away more of the skin here. So I don't know if you can see this. This tendon I'm pulling on is attached down here to the end of the bone. Okay, so let's explore this joint a little bit here. Let's open up this joint. We're going to cut down. You kind of feel where this bone, the end of this bone here, the humerus, meets up with these other bones, and there should be a space in between there of connective tissue that you can cut through to open up this joint. Okay, so we're cutting through the connective tissue that's supporting this whole joint. There's a lot of connective tissue that supports the joint. You can see part of this connective tissue, this tendon here. Cut that. See the ends of the bones here. It's the end of the humerus. Okay, so we can expose the end of the bones here. Here's a tendon. Feel that tendon there. It's really thick, extremely hard white structure. It's attached to the bone, and the other half would be over here. It used to go across the end of this joint, like this one here. Here's a tendon that's still attaching this side to this side, supporting the joint there. So we'll have to cut through that tendon. If we clip that, it's going to come apart more.
Okay.
So now we can see even more of the joint. And we'll just keep cutting down here. And we'll probably just go ahead and cut through up here. Cut through the soft tissue rather than the bones. Here you can see a tendon. It's attached to the bone here. Well, what we're seeing, this part of the bone isn't actually bone. This is the cartilage end. This is where this ball of the humerus fits into this part of the ulna. So you can see those two go together like that to form that joint. But here's a tendon that's joining on to this cartilage. It's clinging right there. You can see it's connected. So if you open this up a little bit more, you can try using your scalpel, your X-Acto also. Just gently, just make sure you're never cutting towards your finger, always cutting away, downward or away. Don't ever try to cut towards your fingers. Okay, so let's open up that joint. You can see all this connective tissue would have been around supporting that joint. And there would have been some joint fluid in there also. So this really shiny white is the hyaline cartilage that's at the end of the bone and lubricates that joint, makes it's real shiny and really slippery. So it's really good for just making a smooth joint like that. And you can see there's two bones here, the radius and the ulna, and the humerus. Okay, so we've got a couple of tendons here to notice. We've got one that's joined to this radius and the ulna, and then they're kind of joined together into one, so they're kind of, it splits and goes to either one of them. And then flip this side over, flip this humerus bone over. Now I peeled the skin back. If you haven't done that yet, you'll just need to peel the skin back of this tricep muscle here. So on the back side of the humerus, on this tricep, you can see again the fascia, the muscles in this bag, and the bag kind of becomes part of the tendon. You see how the white kind of comes down to a little point here? It's like a funnel shape, comes down, kind of becomes, this is the tendon down here. So the stress on the muscle is spread out. So it's like, you know, if you have a bag of, if Santa Claus's bag of toys, you know, with all this fabric around it, and then it narrows down to this neck. So when you're, you know, when you're holding the bag, or if you're pulling on the tendon is pulling on the whole entire bag. But it becomes part of the tendon. The tissues are just kind of seamlessly intertwined. So where the bag ends and where this tendon begins is kind of gradual all in here. But it spreads out over the whole muscle, so the whole muscle is involved in pulling on that tendon, rather than just anchoring it, you know, in the middle or something, and then, well, how is this muscle helping it? The whole bag is helping to pull on that tendon. And you can actually see this tendon coming out down here. You can even grab the end of it and pull on it a little bit there. It's pulling on that whole bag. So see if you can find that structure, that V where it goes down. That's what that is there. And it's real shiny and white in comparison to the muscle tissue underneath it there. So that's the tendon down here.
part of the fascia.
Now we're back over on our ventral side here, and we're going to dissect out one of these bones. So we're going to kind of need to cut the remaining tendons that are trapping the bone there. And we'll need to cut through the muscle. Oh, cutting through the muscle there. To separate out this bone. And oh, there's a nice tendon joining those two. Or a ligament. If connective tissue is joining bone to bone, it's a ligament. And if it's connecting muscle to bone, like in this tendon that we just looked at here, it's a tendon. So that's a tendon. This would be a ligament. Bone to bone is a ligament. So we're going to cut that. And cut the soft tissue. So there we've just separated the bones out. So I'm going to just cut through the muscle tissue here. And we need to cut into this joint a little bit, just like we did on the other joint. Right in between where the bones are meeting up. Okay, so I'm going to peel away this muscle tissue. Okay, so we've got our bone. So on the shaft here you can see this little bloody spot right here. So that's the nutrient foramen, or the nutrient artery. You can see it's still kind of, it's bleeding a little bit. That's the little hole there where the blood supply, the nutrient artery, would go into the bone, and then of course the blood supply would go up and down through those osteons, the blood capillaries going up through those haversian canals in the middle of the osteon, but that's where the nutrient artery goes into the bone, right in the middle there. So then I'm going to just scrape this away.
So should they look for the periosteum?
So yeah, you should look for the periosteum. It's going to be very, very thin, like the skin, but the covering around the bone, the periosteum, is this same shininess. That's the periosteum. And I don't know, probably won't be able to cut it and remove it from the bone. You could maybe try to scrape it a little bit. It's very thin, especially on a bone this tiny. But you can see, you can peel it off. There's part of the periosteum, that protective bag that the bone is in, just like the muscles. So then underneath that would be the compact bone, underneath the periosteum. So if we were to cut this bone in half, we might use our scissors to do that. Okay, so I just cut through this bone. I got a little bigger pair of scissors. You might want to get a pair of kitchen shears to cut through it. Even though it's a tiny bone, it's a little too difficult for your tiny scissors. So we cut through it. So, okay, so here's the bone that we just cut in half. So this is the compact bone. It kind of fractured a little bit. It didn't make a straight cut. So there's this piece of compact bone that's still hanging on here. But in the middle, it's the medullary cavity, the bone marrow would be. And this little ring around the outside, that's the compact bone. Alright, so let's cut open one of the bones here. You can either cut your little one, or you could take a slice of maybe the end of the humerus here. Just carefully slice through the cartilage. See, there's a white piece of cartilage. Take a deeper slice. There we go. Okay. So we've just cut into the red marrow. So surrounded by all that hyaline cartilage, we've got red marrow there. Okay. So if we could do a cross section of the bone, if we could kind of cut it long ways like this. This is a different bone that we cut. It would look like this. So we just kind of sliced a piece off up here and saw this red marrow. There's the cartilage on the outside. See, here's the diaphysis. So here, this is a very young bird. So we have bone marrow here and compact bone on the outside here and the outside here. And then up here, we have a little growth plate. This is where primary ossification started, turning this bone to mineral from cartilage. And then this is the secondary ossification site up here, and where they meet, I think this is the growth plate in between there, I think. See this little line here? It's a growth plate. So now from here, you can maybe dissect out this bone here, the humerus, or you can continue down here and you could open up this joint and work your way down here. You can see this nice tendon here. You could count the phalanges. You could dissect out the bones down here, the carpals or this wrist. And you can imagine if you're doing surgery, surgeons would have to carefully piece each layer and bag back together. Every layer that they cut through, these layers that we cut through, these two, they would want to piece back together, stitch up, lay the skin back over finally at the end and stitch it up. But they would also have to piece together every layer and covering that they go through. So I'm glad that I don't have to put this back together.